Hello, my name is Dr. Stanley Lang, and welcome to this broadcast. This is a continuation in a series that I have been doing on whole person health. My question for you today is, what does microinflammation have to do with exercise? So, first of all, what is microinflammation? And what's the connection with exercise? So, microinflammation is inflammation that is going on at a level that we can't feel. Normally, what we call inflammation causes symptoms that we can notice. Something is aching, something is inflamed looking, that it means it looks red or it's warm to the touch. These are the marks of what we call inflammation. And these have been commonly understood in medicine for centuries, really. The biochemical process behind inflammation has been understood for many decades. But there's this other process that we call microinflammation, which is basically the same chemical process that's going on, but at a level that we can't feel. But that doesn't mean that it's not harming us. And there are many different causes of microinflammation, and one of those causes is exercising too much. So the idea that people can exercise too much sometimes comes as a surprise. And so one of the concepts behind exercising too much is that when we do this, we cause the body to make a lot more free radicals than it otherwise would be making if we weren't exercising too much. So there are certain patterns that we can identify that are likely to produce excessive microinflammation. And one of those patterns is exercising aerobically. That means at a heart rate of 60 to 80% of maximum heart rate for a long period of time. One of the more extreme examples of that would be like running a marathon. That is going to increase dramatically microinflammation in most people, not all people. Some people are trained in such a way and they have the right nutritional basis that it suppresses the microinflammation, but most people not. And most people that overtrain are basically making themselves ill, although they may be doing it so slowly they don't notice it. So as you probably know, there are structures in the cell that are called mitochondria that are responsible for making our energy molecules. Well, as they are making these energy molecules, they inevitably throw off some free radicals. That's just part of the process. When they're pushed to the limit, as if you would take a furnace and throw in 10 times as much coal as you otherwise would, and the sides of the furnace are literally red because they're so hot, you're actually damaging the furnace when you do that. You're damaging the walls of the furnace, the integrity of the furnace. Same thing happens to the mitochondria. When there's excessive free radical production, it's like there's too much heat coming off, and it really damages the lining or the membrane of the mitochondria and the insides of the mitochondria, and so it becomes less efficient in energy production and less likely to live as long functionally within the cell. At some point, the cell has to take that mitochondria and either take it out of function or recycle it. Now, when we exercise too vigorously, what we do is turn the heat up in these mitochondrial production, basically, and burn them out faster than normal. Now, there are some ways to exercise that are less likely to do that. And I had a discussion with one of my patients today who has a very serious autoimmune condition that already has too much inflammation going on in his body. So anything he does that increases inflammation is a bad idea. And so the wrong kind of exercise is a bad idea for him. Even if he thinks it's going to get him better in the long run, it won't. And he is simply the canary in the mine when it comes to everybody else who doesn't have that kind of autoimmune condition. So we don't sense the damage of microinflammation as easily as he does, but he'll just start hurting a lot more because the increased inflammation makes his joints hurt more. And so this microinflammation is basically causing anything in his body that's already inflamed to be more inflamed. It's like pouring oil on a fire that's already burning, as opposed to starting a fire that wasn't already there. And for most of us, as we get older, we've got a lot of these little fires already going in our body, and what we need the least is anything that increases inflammation. Now, too much exercise is only one of the things that can do that. So what's the solution? Well, first of all, moderation in everything. And unless you are an elite athlete, there is no benefit to you to be exercising as if you were an elite athlete. So you need to learn how to exercise smart. One of those strategies is to use the strategy of high intensity interval training, which is becoming a lot more popular nowadays, and has been popularized by several famous physicians, which I wouldn't go over right now. But when you do high intensity interval training, you basically push yourself to maximum, and you push yourself into anaerobic activity in addition to aerobic activity for a short period of time, and then you allow yourself to relax and to rest and then recover, and then you repeat that, and you repeat that about 12 to 15 times. Now, when you do that, you don't produce a lot of excessive free radical production. So the excessive free radical production that is characteristic of sustained aerobic activity doesn't happen in this high intensity approach. So the alternative is to exercise at a low aerobic intensity for maybe 30 to 40 minutes, but not very often past that, 60 minutes at the most, maybe once a week. If you do it more than that, you're just asking for increased inflammation in your body, increased tissue breakdown, increased risk of injury, and those little mitochondria that I was telling you about, they're more likely to wear out. So just like my patient who has this autoimmune condition, and he's got a lot of places in his body that are already inflamed, we do too, we just can't feel them as much. And when we over-exercise, we push it too hard, too long, too frequently, we're going to increase inflammation and actually cause an increase in the probability of disease. It's well known that people that exercise way too much increase their risk of heart disease, increase their risk of cancer, because the immune system is getting whacked through this process. So I hope you found this encouragement helpful, because a lot of people don't exercise because they think they got to exercise way too much and they don't feel like they don't have time for it. When you do a high intensity workout with the interval training, the 12 to 15 intervals, you can be done with your workout in 25 minutes, and doing that 4 days a week will get you into good shape. So I wish you well, God bless, and have a great day.